Happy Friday. Today is April 3rd, 2020. This is Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District, bringing you a coronavirus update for today. Many of you are at home with your family, and this coronavirus is spreading throughout the United States of America. And today we see that coronavirus death has gone up 25% in the United States of America, with 1,495 people dead in one day. So when we look at the figures for United States in one day, number of deaths has gone up to 7,406 from 5,911 yesterday. So that is an increase of about 1,500 people in 24 hours. So that's a lot of people dying in one day. And the number is steadily going up, unfortunately. Confirmed cases has gone up as well. Yesterday it was 244,678. Today, confirmed cases stand at 276,995. So that's about an increase of 30,000. So that's a lot of new cases. So when you compare the increase of confirmed cases, which went up by a little over 10%, we see that death rate is going up at a much faster rate, which is going up at 25% per day. Now, I have top 6 areas in the USA with COVID-19 deaths. New York City is number 1 currently with 1,867 deaths. And second place goes to other areas of New York State, according to Johns Hopkins School of Medicine Coronavirus Resource Center, and it's 955 deaths. Governor Cuomo was saying that hotspots for COVID-19 are rising outside of New York City now, and he foresees kind of a ripple effect where hotspots for coronavirus deaths radiate outside of New York City and spread throughout the whole state. So with passage of time, you're going to have more and more people dying in other parts of New York State. Third place for death through COVID-19 deaths is the city of Wayne, Michigan, which has 223 total deaths so far, which is a surprise because Michigan wasn't even in the map several days ago, but now you see Michigan playing a significant role in terms of showing us what a hotspot for coronavirus death could be. So it can just crop out of nowhere. It could happen in any city. Fourth place stands at King County, Washington State with 186 deaths. And fifth place, and this is a surprise as well, is New Orleans, Louisiana, with 148 deaths. And sixth place is Cook County, Illinois, with 141 deaths. Some interesting areas are seeing outbreak of COVID-19 cases and death rates rising. So it'll be kind of interesting to see what the ranking will be in a week. Now, as death rates rise and cases of COVID-19 rise in the United States, in all 50 states, there are some questions that we want to think about. What do we do with our older adults during COVID-19 crisis? Some experts have said that this could continue on for 18 months or more. Other experts are saying, well, our first outbreak that started in January, February will start trickling down in the summer, and then there will be a second wave that starts back up again in the fall that will go on to the following year. So there are different opinions about what will happen in terms of COVID-19 crisis. Is it going to be continuous outbreak in the United States with no cessation? Or will we have a peak and then a wane and then a short period of pause until it starts back up again in the fall or winter? We just don't know right now. Experts don't know. In fact, experts don't really know exactly what COVID-19 is. They know it's a virus, but they're not sure how it's transmitted. Some people say it can be transmitted within 6 feet. Experts at MIT say it can be transmitted at the distance of over 10 feet. I mean, who's right? So right now, a lot of the experts are guessing. They don't really know what COVID-19 is, unfortunately. What does this mean? Most likely we are in it for the long haul. And some experts have been saying that you should isolate elderly or older adults and that you should not visit them. But let's think about this from a human angle. If coronavirus crisis will continue continuously for 18 months or more with people dying, President Trump's team is saying that we can have over 200 people die by August. And some are saying it could be much higher than that. If death rates are rising and coronavirus case will continue nonstop for over 18 months, or maybe it will go up and down and there will be a short break, but it will start back up again in the winter. And that could be a worst case. Some are saying the second wave will be much worse than the first wave. Then should we really leave our older adults alone? Let's say you have a grandma or grandpa or grandma and grandpa living alone somewhere. And should we just leave them there? So that's, I guess, a human question, right? Before they could go to community centers and group programs to entertain themselves so they could mingle with other older adults. So the life wasn't so lonely or boring for many older adults. But now with Virginia ordering staying at home, order Washington, D.C. as well, and Maryland, and many places throughout the United States of America, older adults are alone at home by themselves. And some older adults live alone, like a grandma by herself or grandpa by himself. And they can't really go to any of these programs they used to be able to go to. Programs where they can share joy with other older adults. So they're all alone. So they will be lonely. Maybe they'll have experience of depression and anxiety and fear. And so I would like to raise the question about whether it's humane to leave your grandma or grandpa by himself or herself, especially if they are widowed. This could last for 18 plus months. I mean, hopefully it ends soon, but it may last a long time. And should these older adults die alone, lonely, depressed, anxious, and in fear? That doesn't seem very kind or humane. So I would actually suggest that if you have a grandmother or grandfather living alone, that you bring them to your home, to your family, to live with you. And I would argue that this is the right thing to do on several levels. Number one, when a grandma or grandpa lives with the family, not knowing when they may die, it will give joy to their lives in the last moments of their lives. More importantly, from a mental health or healthcare perspective, by having your grandma or your grandpa live with you at home will help them to reduce depression, anxiety, and fear. And evidence-based research has shown that anxiety, fear, and depression can lower a person's immune system. So grandma living alone, depressed, anxious, and fearful may have her immune system reduced, thereby making her vulnerable to all kinds of illnesses, including COVID-19. And we still don't know how COVID-19 travels throughout the world. It could be like Poland, traveling in the air. We just don't know yet. And so by bringing your grandma back home to live with you and your children, you may actually elongate her life. She may live longer because she is now living with you and your children. Her immune system will be stronger, and she'll be less anxious or afraid. There are also physical consequences as well. When a grandma or grandpa lives alone, he or she may forget to drink enough liquid, may become dehydrated, which can cause them to go into shock and death. And they may die alone in their home because they forgot to drink water due to depression or forgetfulness. And they could be lying dead in their home floor for hours, for days, depending on how often you visit your grandma or grandpa. And that's kind of sad, don't you think? Whereas if you bring your grandma or grandpa who's living alone back to your home, she can or he can talk to your children, talk to you. Just by being in the presence of their children and grandchildren, they will derive not only happiness, but support, right? You can remind your mother or grandmother, oh, did you drink enough water? Make sure that they eat 3 courses of meal per day. You can better take care of them. And think of it from this angle as well. If your grandma or grandpa lives alone, they'll have to go buy groceries by themselves, in which case they make themselves vulnerable to getting COVID at the grocery store. Whereas if they live with you, you could just buy the groceries so your grandma or grandpa doesn't have to go anywhere, which will make them safer and less vulnerable to getting COVID-19. You may do shopping for your mother or father or grandmother or grandfather, but they could run out of things. When they run out of things, they can't wait for you to get them. So they'll go out to get them, and they could catch COVID-19 at that time. Whereas if they live with you, they could say, oh, I ran out of this, and then you can just go out and get it. So they will be physically safer, and their chance of getting COVID-19 will decrease if you bring your grandma, grandpa back home to live with you. So Heerak Christian Kim, which I am, who is running for U.S. Congress in Virginia's 8th District, that's Arlington, Alexandria, Falls Church, and parts of Fairfax County. as an independent candidate for US Congress is encouraging all of you to bring your grandma or grandpa who's living alone back home to live with you during this COVID-19 crisis. That is the humane thing to do. That is the right thing to do. And it will decrease spread of COVID-19 for the reasons that I have explained. And that will be better for society. So I hope that you will bring your grandma, grandpa, older adult father or mother back home to live with you this weekend. And that is the advice that Heerak Christian Kim, independent candidate for US Congress in Virginia 8th District, is giving to everyone in Virginia, Washington, D.C., Maryland, and throughout the United States of America. Share this video with your friends throughout the United States of America so they can think about this and they can decide to do the right thing. Heerak wants you to be well. Heerak wants you to survive. And Heerak wants your mother and father, your grandmother and grandfather to survive. You can subscribe to this YouTube channel and watch for more great advice that will help you and your family and that will stop the spread of COVID-19 throughout your communities. Be safe and be well.